Welcome to Anatomy Video Flashcards for movement and muscle action. Turn to page 76 of your lab manual to follow along as your TAs demonstrate the hottest contemporary dance moves and their associated muscle actions. To use the following flashcards as flashcards, pause the video as each new movement arises and try to list the movement demonstrated and the prime movers and synergists used during that movement. This is flexion of the arm at the shoulder. The prime movers are pectoralis major and the deltoid. Synergists are coracobrachialis and biceps brachii. This is extension of the arm at the shoulder. Prime movers are latissimus dorsi and the deltoid. The synergist is teres major.
This is abduction at the shoulder. The prime mover is the deltoid, and the synergist is the supraspinatus. This is adduction at the shoulder. The prime movers are latissimus dorsi and pectoralis major. The synergists are teres major and coracobrachialis.
This is horizontal abduction. There are no prime movers. The synergists are infraspinatus, teres minor, and the deltoid. This is horizontal adduction at the shoulder. The prime mover is pectoralis major. The synergists are the deltoid and coracobrachialis.
This is lateral rotation at the shoulder. The prime movers are teres minor and infraspinatus. The synergist is the deltoid. This is medial rotation at the shoulder. The prime mover is the subscapularis. The synergists are teres major, latissimus dorsi, and pectoralis major, and the deltoid.
This is protraction at the scapula. The prime mover is the serratus anterior. The synergist is pectoralis minor. This is retraction at the scapula. The prime mover is rhomboid major. The synergist is rhomboid minor. This is upward rotation of the scapula. The prime mover is serratus anterior. The synergist is the trapezius. This is downward rotation of the scapula. The prime mover is pectoralis minor. The synergists are rhomboid major, rhomboid minor, and levator scapulae.
This is elevation of the scapula. The prime mover is levator scapulae. The synergist is the trapezius. This is depression of the scapula. The prime mover is the trapezius. The synergist is the pectoralis minor.
This is flexion at the elbow. Prime movers are biceps brachii and brachialis. Synergists are brachioradialis and pronator teres. This is extension at the elbow. The prime mover is the triceps brachii, the synergist is anconius.
This is pronation at the elbow. The prime mover is pronator teres. The synergist is pronator quadratus. This is supination at the elbow. There is no prime mover. The synergists are biceps brachii and the supinator.
This is flexion at the hip. The prime mover is iliopsoas. The synergists are tensor fasciae latae, sartorius, rectus femoris, adductor longus, and pectineus. This is extension at the hip. The prime movers are gluteus maximus and biceps femoris. The synergists are semitendinosus and semimembranosus.
This is abduction at the hip. The prime mover is gluteus medius. The synergists are gluteus maximus, gluteus minimus, piriformis, tensor fasciae latae, and sartorius. This is adduction at the hip. There is no prime mover. Synergists are adductor magnus, longus, and brevis, gracilis, and pectineus.
This is horizontal abduction at the hip. The prime mover is the piriformis. Synergists are the obturator internus, superior gemellus, and inferior gemellus. This is horizontal adduction at the hip. The prime movers are the adductor magnus, longus, and brevis. Synergists are pectineus and gracilis.
This is medial rotation at the hip. There is no prime mover. Synergists are gluteus medius, gluteus minimus, tensor fascia latae, adductor magnus, longus, and brevis, gracilis, and pectineus. This is lateral rotation at the hip. There is no prime mover. Synergists are gluteus maximus, piriformis, obturator internus, superior and inferior gemellus, and quadratus femoris.
This is flexion at the knee. The prime movers are semimembranosus, semitendinosus, and biceps femoris. The synergists are gastrocnemius, plantaris, and popliteus. This is extension at the knee. The prime movers are the quadriceps muscles. The synergist is the tensor fascia latae.
This is plantar flexion at the ankle. The prime movers are gastrocnemius and soleus. The synergists are plantaris, flexor digitorum longus, tibialis posterior, fibularis longus, and fibularis brevis. This is dorsiflexion of the ankle. The prime mover is tibialis anterior. The synergists are extensor digitorum longus, fibularis tertius, extensor hallucis longus.
This is inversion at the ankle. The prime mover is the tibialis posterior. The synergists are the flexor digitorum longus, flexor hallucis longus, and tibialis anterior. This is inversion at the ankle. There is no prime mover. The synergists are the fibularis tertius, fibularis longus, and fibularis brevis. This is flexion at the knee. The prime movers are the semiobrachiosaurus, semitidodinosaurus, and the bicep femosaurus. The synergists are the gastromenipidius, the planetarius, and the pupillitis.